So we have continued to see very high hospitalization numbers due to RSV and flu. And as Dr. Priest mentions, a lot of this is very atypical. The seasonality of this tends to be January through March for influenza as well as RSV. But we're really seeing a lot of it at very atypical times, and that's because of the social gathering, not wearing masks, things like that. Unfortunately, with RSV, except for in very rare cases of premature children, there is no vaccine. But there is for influenza, obviously, and we continue to encourage people to get their flu vaccine as soon as possible. While it may not protect you from 100%, we know that it obviously can do a lot of good. And it's not just the influenza infection that is a risk, but as Dr. Priest mentioned, some of the downstream effects, including even bacterial pneumonias on top of influenza and RSV, is something that we've seen very high numbers of over the last few months. So while the absolute numbers of influenza and RSV in terms of positive tests in pediatrics seems to be dropping somewhat over the last couple of weeks, we continue to see these very high number of hospitalizations. It's really clearly had a significant impact throughout North Carolina, where over the last several months, we have had, it's actually quite common that all of the hospitals are full in the pediatric intensive care unit as well as the pediatric floor, with the majority of these RSV and flu patients. While it may change a little bit day to day, in general, it's been one of the busiest times that I think North Carolina children's hospitals have experienced over the last few months. And part of that is not just the numbers of these illnesses, but it's that it tends to be very potent or powerful this year, it appears, where some of these children have not experienced flu or RSV in the past. When they're getting this RSV or this flu infection, it tends to be what we would say very virulent or powerful, and it's causing significant injury and illness in these otherwise healthy children. Whereas in the past, especially with RSV, it typically affected mainly premature babies or very, very small babies. We're now seeing 1, 2, 3-year-olds, 5-year-olds who are being admitted with RSV infections and ending up quite ill. So it's not just about the number of infections, but it's about how potent the infections are this year. And it continues to really be a strain on the healthcare system. So, if there's anything, if you have concerns about your child, obviously taking them to the pediatrician is always the smartest thing. If they're breathing hard or they have any changes in color of their lips, you have any concerns, then obviously always to call EMS. But we just encourage people to continue to do the things that we've done over the last few years, which is social distancing, making sure people are vaccinated, and washing their hands. As part of our normal history taking, we always ask families about immunization status and previous illnesses. And so we typically do ask about COVID infections, RSV, influenza, anything that they've had in the last year or so. From my experience, I'd say just anecdotally, we are not seeing any type of direct correlation that would say that having COVID in the past puts you at a higher risk for RSV or influenza. I don't know any further details beyond that, except to say that we haven't seen any direct correlation.